We're now getting ready for a meniscus surgery. This is an arthroscopic surgery of the knee. It's the most common surgery that's performed by orthopedic surgeons. So the meniscus is called fibrocartilage. It's actually a piece of tissue that works as a shock absorber in the knee. It helps protect the cartilage that lines the bones and prevent arthritis. When we're young, the meniscus is soft and moist, and as we get older, it gets a bit harder and dried out, and it tends to tear over time, even from no injury. So our goal today is to remove the torn piece and allow the healthy remaining meniscus to continue to cushion the knee and act as a shock absorber. Typical signs and symptoms of a meniscus tear are pain, either on the inner or outer side of the knee that often radiates to the back of the knee. This pain can occur with walking, jumping, running, or sometimes just standing up from a chair. The best way to diagnose a meniscus tear is by a physical examination. Often your physician or surgeon will order an MRI to confirm that diagnosis. Fortunately, MRIs are about 95% accurate in diagnosing a meniscus tear. This surgery for a torn meniscus first involves, like any arthroscopic surgery, a diagnostic arthroscopy, and that's just a formal name for looking around. I'll put the camera in the knee through a small incision and then have a second incision for tools and instruments. And I'll look at all three parts of the knee, including the inner or medial aspect, the lateral or outer aspect, as well as the kneecap joint, what we call the patellofemoral joint. And I'll look at the cartilage, the meniscus on both sides, the ACL and PCL, the ligaments we hear about athletes injuring, as well as other spaces in the knee to look for problems that need to be addressed. So this surgery lasts about an hour. Patients typically go home an hour later with very little pain. Some patients will take pain pills for a day or two after surgery. Most people are up walking around within 2 or 3 days and back to everyday normal activities by 3 or 4 days. Patients often come back to my office in a week with significant pain relief, meaning they feel much better than they did before surgery. Then they'll either start to exercise on their own or go to a physical therapist for rehabilitation. And I tell patients they can expect to be 80 to 85% better and back to their full activities at 1 month and 90 to 95% at 2 months. So here's the inner compartment or medial compartment of the knee. You can see the thigh bone up here. It's round and it's smooth and it has healthy looking cartilage. And down here is the shin bone. It's more flat but also smooth with healthy looking cartilage. And in between is the meniscus. That's this pad right here. It's shaped like a C. It starts in front here, right here, sweeps around and ends in the back here. So it's shaped like a C, and it should be perfectly smooth everywhere. The reason we're here today is because this meniscus is torn. So first of all, you can see this frayed area that doesn't look healthy. And then if you feel and reach underneath, this piece is all torn in here. You can see underneath how there's tearing going on all the way beneath the meniscus, and that's the reason for her pain. There's also tearing way in the back here. That piece is flipped up and should be sitting down properly, but that's torn as well. So we'll use some specialized instruments to start cutting away the torn meniscus. So this is an instrument that has sharp cutting teeth that open and close and allows us to cut just the torn part and leave the healthy part. Okay, so now we use a shaver, which is a tube with suction, so you can see as I turn the suction on, things get drawn in, and then the teeth rotate, so it cuts bad tissue that gets sucked into here. So now we'll use the suction and the teeth together, so it sucks in bad tissue, cuts it, and leaves the good tissue intact. And the key is to leave healthy tissue that's smooth and not going to be prone to tearing again in the future. So now we're done. You can see that there's now a smooth margin. There's no more loose pieces. I can't pull on anything. When I pull, it stays put. That's a nice healthy, what we call meniscus rim. There's still some meniscus left here, and in the back we can see. But the torn portion is gone, and when she stands up and these two bones touch again, the meniscus will be a cushion rather than a hindrance or a mechanical irritant. So she should have a pain-free knee, hopefully in a couple of weeks once she's rehabilitated from the surgery. So that patient with the meniscus surgery should have excellent pain relief. As you can see from the video, this procedure moves relatively quickly and is completed in a short period of time, and that allows the patient to wake up from anesthesia quickly, get home and usually with very little pain, and get back to their daily activities within a week or so. and hopefully return to sports in the next 3 to 4 weeks. And that's the great benefit of doing a surgery like this at an outpatient surgery center like Lapeer. We have fantastic staff here that make the preoperative process, the check-in process, very easy and comfortable. We have excellent anesthetic staff and surgical support, and that allows the surgery to move smoothly. And our postoperative nurses are also excellent, paying close attention to pain management and making our patients comfortable before they go home. All the other patients here are here with similar problems. Nobody's ill, nobody's here because they have an infection. Everyone's here because they have a problem that can be properly managed at an excellent outpatient surgery center with a friendly staff, and get home safe and recover quickly.